Surgical stitches, also called sutures, are used to close wounds after surgery or injury. They help the skin heal properly, reduce bleeding, and prevent infection. In this video, we will explain surgical stitching step by step in a simple way for beginners. First, the wound area is cleaned properly. Doctors use antiseptic solutions to remove dirt, bacteria, and blood from the skin. This step is very important because a dirty wound can cause infection. Next, local anesthesia is given. This medicine makes the area numb, so the patient does not feel pain during stitching. After anesthesia, the surgeon selects the suture material. There are two main types of sutures: absorbable sutures, which dissolve on their own, and non-absorbable sutures, which need removal later. The needle used for stitching is usually curved. A curved needle helps pass smoothly through the skin without causing extra damage. Now the stitching process begins. The needle is held with a needle holder and gently passed through one side of the wound. Then it comes out from the other side, bringing the thread with it. Both sides of the wound are carefully brought together. The surgeon ties a secure knot, but not too tight. Too much tightness can damage the skin and slow healing. This process is repeated until the entire wound is closed. During stitching, proper spacing between stitches is maintained. Even spacing helps the wound heal evenly and reduces scar formation. Once stitching is complete, the wound is cleaned again. A sterile dressing or bandage is applied to protect the area. After surgery, wound care is very important. The patient must keep the area clean, dry, and follow doctor instructions carefully. Signs of infection include redness, swelling, pain, or pus discharge. If any of these appear, medical help should be taken immediately. Surgical stitching is a basic but very important medical skill. With practice, precision, and proper technique, safe healing is possible. If you want to learn different types of stitches, knot techniques, and real surgical demonstrations, watch our long videos for full details. Like the video, subscribe to the channel, and stay connected for more medical education.